5,000 breast cancer sufferers could be spared chemotherapy if offered genetic testing. This was a headline that caught my eye today as I was sitting here having my morning coffee. This article stems from one of many peer-reviewed studies being released every month. There are literally thousands of these studies every year that speak to the incredible benefits of genetic testing for early detection of cancer, for identifying the right treatment for each patient. We can now look beyond the old rudimentary diagnostics of the location of cancer. Has it arisen in your breasts or your prostate or your ovaries or your brain or on your skin, to on the cellular level, what has caused your cancer in the first place? In response to this new ability, an entirely new industry is built up in just the last decade. It's called precision oncology. It sounds space age, but it's a real thing right now. You see, it occurred to cancer researchers that if it's possible to use genetic testing to find out what has gone sideways in a cancer patient's body, in other words, what genetic mutations have occurred and driven cancer to develop, that they could also maybe use that information about those genetic mutations to develop treatments that target those genes, and they did. You see, some mutations make your cells grow out of control, or they help those out of control cells along in some way by keeping your body's natural resources and immunity down, or by helping it to gather more food and more fuel for survival. These are called oncogenes, and there's no other way to describe them, but they suck. Scientists have created specialized cancer treatments called targeted therapies that, like microscopic seek and destroy missiles, they go into your body and they search throughout your body for any cells that harbor those mutated genes. And they attach to those cells and they find a way to dissolve those genes that we don't want anymore, leaving your cells alone, leaving your healthy cells alone as well, so that what happens in targeted therapies is that only the cells carrying those mutated genes are affected by the treatment. This is why in targeted therapy we have so much greater success and so much fewer side effects, because in chemotherapy and radiation, one of the reasons patients have such strong adverse side effects is because all of your rapidly reproducing cells are being targeted. Your hair and skin cells, all of the cells that you need in order to live and grow as a human being are also being targeted at the same time, because until recently, with this advent of this new type of therapy, we couldn't differentiate between the cancer cells and the healthy cells that were rapidly reproducing. So we had to use chemotherapy and radiation to target all the rapidly reproducing cells. So that's why people have such nasty side effects with chemo and radiation as a rule. And that's why precision oncology is such an exciting advancement for cancer patients, because it allows you to get the best possible outcome from your treatment with minimal amount of side effects. So in addition to those oncogenes that grow out of control, there's also mutations that affect how well your body's natural cancer-fighting pathways work. And so research invented treatments to help those pathways function more effectively. So you can use your body's natural immune system to help fight cancer. These are called immunotherapies. The point here really is, as I said, there are thousands of these articles coming out every year. And there are literally hundreds and hundreds of known genetic mutations that influence cancer. And there are many targeted therapies that have been developed already, with new targeted therapies coming out all the time. Study after study shows that targeted therapies give cancer patients longer progression-free survival rates with fewer side effects. And to the person with cancer, that translates to a longer, healthier life. And that's what it's all about. But here's the rub. You can't get targeted therapies if you haven't had genetic testing. So this article talking about 5,000 women alone in the UK who could receive more targeted treatment and avoid the unnecessary side effects and reduced benefits of chemotherapy is really just addressing the tip of the iceberg, because every cancer patient needs access to genetic testing. Otherwise, there's so many possible treatments that are being left on the table. And again, it increases their chances of survival significantly and ensures that you get the best possible treatment for your disease. Without genetic testing, the best that your oncologist can offer you with any confidence at all is what's been done for the last 40 plus years, which is chemotherapy and radiation. And there's nothing you can do to argue for anything else without genetic testing, because you don't have any proof to say what's causing your cancer and what will work. So many cancer patients, knowing intuitively that there's more that can be done, and yet being offered these standard options of chemotherapy and radiation, many cancer patients go outside the allopathic or mainstream medicine. But sadly, they don't often go or always go to evidence-based treatments. They go instead to alternative therapies, perhaps with lots of anecdotal evidence or good marketing strategies, but with little or no proven efficacy. And what happens then is they spend a lot of money and they waste a lot of precious time. At best, those alternative treatments don't harm them and they just waste time and money. But oftentimes these alternative treatments have their own side effects, and they actually help cancers to grow. And we'll talk more about that too. Down the road in further videos, we're going to look at some of these alternative treatment facilities and look at how you yourself can tell whether what you're thinking about doing for a cancer treatment really has evidence to back it up, what you can truly expect from it, and whether it's really the right or best thing for you. But right now, what's most important that you understand is that genetic testing makes all the difference to you getting the right treatment for your cancer. And without that, the best that you and your oncologist can do is guess and hope for the best. And in 2019, that's not necessary. There are many other things that can be done to help cancer patients have longer lives and fewer side effects throughout and after treatment. But again, genetic testing is where it begins. In fact, in 10 years in this field, I have seen only 2 instances where standard chemotherapy and radiation were the best treatment option for a patient. That's 2 times in hundreds and hundreds of patients that I personally have interacted with, where standard chemo and radiation really was the best. So it's not actually the norm. And what we see now from our own clinical research, as well as many other peer-reviewed scientific studies, is that when genetic testing is used as a diagnostic for a cancer patient, almost every single time the initial treatment plan is modified significantly. So that means that your oncologist is willing to look at this evidence, but oftentimes their hands are tied in their ability to get it for you because of the system in which they're working. So it relies on cancer patients to be able to understand what's possible in terms of diagnostics and how to access these diagnostics and bring them to their oncologist in a way that holds their oncologist accountable to paying attention to this new evidence and to using it in the designing and delivery of their treatment plan. My main point here is, if you haven't had genetic testing, you and your doctor are guessing about what caused your cancer, and therefore you're guessing about how best to treat it. And that might be an appropriate course of action for a rash that's just come out after you came in from a hike in the woods, and wait and see and watch that for a day or two. Try your usual rash cream. That might make good sense for something like that. And then after a couple of days, you can go to the doctor and get a more thorough diagnosis, or try something else if your initial plan doesn't work. But when it comes to a life-threatening illness like cancer, wait and see or hope for the best is not a functional strategy. And again, until not so long ago, that was really all we had available to us worldwide. There just was no other way to find out what was causing cancer and what to do about it. But now there is. And so as cancer patients and as oncologists or people in the cancer care field, we really have no excuse except really money and what our system allows us to provide to not provide cancer patients or potential cancer patients with proper genetic testing to make sure that they're being diagnosed properly and that they're getting the right targeted therapy. So ultimately, my point is genetic testing for everyone. It's just silly not to. Even if you're stage 4 and you've already tried everything and your oncologist is telling you that there's nothing more that can be done, if you haven't had an FDA-approved broad genetic testing panel, your oncologist can't actually say with confidence that everything that can be done has been done, and you don't have any reason to just accept that. So don't settle. If you have cancer of any kind, don't just cross your fingers and hope for the best. Find out for sure what made cancer happen in your body. Find out what treatments exist right now that can target those mutations and help you have a longer life and better quality of life. If you'd like to stay connected and find out more about all these different types of targeted therapies and how to advocate for yourself with your oncologist, just hit the subscribe button below, hit the bell, make sure that you stay connected. And if you have a question that you'd like me to answer for you about your specific case or about cancer care in general, or even some sort of alternative therapy that you'd like me to explore on your behalf, I'd be happy to do that. Just leave me a comment in the comments section and I'll answer some of those questions every week. So my name's Michelle Morand and this is Cancer, Just the Facts. Have a good day.